When you give birth, you want to follow the vaccine calendar to the end. Yeah. But most people do not really understand. You go, they give you the polio, they give you the DPT vaccines, the yellow fever vaccine, and all of that, but they don't understand what this is. If they had a better understanding of what this is, they'll explain to their children, and they themselves will gain knowledge.
Hello, good morning, and welcome to another exciting episode of Back to Doc. My name is Ik Ogbonna, and with me is the beautiful, delectable African goddess, Adelle.
I did not pay him to say that.
No, but that's what you are, you're an African goddess.
Neither did I pay him to say that. But I'm very happy to be back here having conversations that help Africans make decisions about their health. And today we're going to be diving into something I met when I was really young in Kenya, and I still distinctly remember seeing the vaccination process happening and wondering, okay, where are these people coming to our house? Where's there an X on that gate and ours doesn't have? And I'm talking about polio.
Yes.
And to help us do that, we have some amazing guests.
And with us today, we have Nora over here, and we have Leah, who will be helping us to make this episode even more exciting. So, Nora, could you mind telling us more about yourself?
I'm Nora Mingo, currently a clinical research professional, but basically trained as a nurse. And I have been active in this polio campaign for like 20 years.
What?
Back in the days when I was still training to become a nurse.
Yeah.
Climbing and descending hills to reach out to families.
Oh my goodness.
Yeah.
Can't wait to hear more.
There'll be a lot of topic
experiences.
Exciting. It's an exciting experience.
Yeah. And so maybe we can hear a bit more about you, Leah, who's from my home country, Kenyans
Kenya,
representing.
Swahili.
Yes, I'm going to speak in English, but maybe we can throw in some Swahili.
I know.
Well, I know Nakupenda.
Of course, you know.
Out of the way,
It means
Nakupenda.
I love you.
And you can add sana to it, right?
Nakupenda sana.
No, you're not saying it well. Sana.
My goodness. So Leah, you can tell us a bit about you.
Yes, so my name is Leah Mwai. I'm a researcher and innovation expert. I would say enthusiast. And I've been working in development for a while now. And what really excites me is just thinking about how to really bring the voices of everyday people into the conversations that are more scientific, about health, about decisions that are made about them. So really excited to really talk about this.
Yeah, and that's really important because sometimes whatever happens in the lab stays in the lab and people speak in terms that only people in the lab understand, but it affects the lives of everybody every day, right? So I remember polio from when I was much younger, and the X's on the gates, I think it's probably the one and only time our country, Kenya, was organized. Because I have to say the vaccination process was very organized for polio. And I remember like once they're done with one house, you get an X, and then you're all waiting for, okay, when are they coming to our gate? You know? But how did you guys first hear of polio? Was it the same in terms of your experiences?
For me, I can't really remember when I first heard about polio, but I would say when I first really became aware of it, I was involved. Back in the days when I was in school, when we had to do internships in hospitals, the campaigns were going on, so we're forced to join the staff to go out during these campaigns to vaccinate children.
So let's start with a quick definition. What is polio?
Poliomyelitis, actually, known as polio. It's a very contagious, infectious disease caused by a virus that mostly affects the muscles, weakens the muscles, leading to paralysis. And in severe cases, it can lead to death. Yeah, we have We have that. Before, back in the days, like in the 50s, in the 60s, it used to be very terrible. Yeah, it used to be very terrible back then. But now, thanks to vaccination and surveillance and education, awareness, you see, it has actually dropped. Right now in the world, we're talking about the eradication of polio. Just to let you know, back in those days, you used to have about 3,500 cases of polio in more than 125 countries. You understand? And you know what that means. Like I said, it leads to death, it leads to paralysis. So you can understand paralysis, excuse me. You can understand what that means. But now, when we talk of polio, we say we are 99.9% on the route eradication, which means what is left? 0.1. And what is happening and where is that? Unfortunately, we still have polio around. It's not gone. That's why we're talking about it on this table. It's still there. It's not eradicated. We have polio in Pakistan and in Afghanistan. I think it remains endemic in these areas because of the insecurity in the countries. When the campaign was going on globally, this country was had to rage due to the poor governance, insecurity, and of course we know the mixed feelings people have about vaccines. But thank God, like I said, we are almost there, getting 99.9% to eradicating polio. But again, not only that, we have cases in Africa too. Right here, yeah. We have in Congo, we have in Cameroon, we have in Nigeria, we have in Ghana. So these are countries which were already declared polio-free. But now we have new cases.
And I have to say, I love your definition, because when I think about my first interaction, the only thing I remember is like the X's on the gate and the end result. I know there was a lot of talk of paralysis, etc. But the in-between, I didn't really get that. Was that the same for you, Leo? Do you remember actually being explained to exactly what polio was when you first heard of it?
Yeah, I was just trying to think when you guys were talking. I think my very first vivid, when I can remember I first encountered polio was in high school, because one of the teachers that had the most impact on my life, he was our art teacher. He used to walk on crutches and he was paralyzed. And we always wondered where that came from. And I think later when when you're students, you ask, and we learned that he had caught polio as a child. And of course, then I went home and asked my parents, what's this polio? What is it? And I think they explained a little. My grandmother especially talked about how that was a disease, like in that age group of my parents and before. People were, catching it and getting sick, and that, okay, that's why we get vaccinated. So there's a little bit of that explained. And I think the only other thing I remember, apart from the X's that you're talking about, was the polio t-shirts in Kenya.
Oh, yes!
Do you remember the goodies?
Oh my goodness, yes.
You got a t-shirt.
And
we had all this. Yes,
right?
exactly.
The kids got t-shirts.
Yes, we got t-shirts. So there was all this. So there was a lot of people, if you go to the market, who are wearing these t-shirts that are written "Kick Polio," and they were like representing the polio campaign.
I remember Kick Polio.
So I think they really, so we all knew somehow, there was this consciousness in the society that there was something called polio, and we were kicking it.
Yeah, exactly.
It was kind of visible.
We had access.
Yes, and I kind of, for me, as I said, I still remember, because my teacher, he was an art teacher, and he was very, very like even now I just remember him and really wondering, oh, how did he become like this? And then learning that this is, when I learned that this is, this disease is the one that causes this in the population. But that happened more in my parents' generation and before.
It's very obvious that vaccination helps to prevent polio, but how can we cure polio? Can it be cured?
Unfortunately, there is no cure for polio, but polio can be prevented. Yes, there is no cure for polio, but it can be prevented. For us to be able to prevent polio, we need to create awareness, educate the people, but most importantly, what the main thing that prevents polio is the vaccine. There are actually vaccines against polio. There are two kinds of vaccines. You have the OPV, oral polio vaccine. You have the IPV polio vaccine, which is injectable. these vaccines are actually available. I don't know, back in Kenya, what did they give you? Were you injected or you were
We got the
they-
t-shirts.
you got the t-shirt, and I bet they dropped something in your mouth. Yeah, that is the oral polio vaccine.
I
Most
remember we were kids then.
I know, like,
Yeah.
I just know I went to the hospital with my parents.
yeah, they'll remind you. And even nowadays, it's still going on. Like we still vaccinate kids. So we have the vaccine. There's two kinds of vaccines that are very available and have been integrated into the vaccine calendars for children, because polio, you should know, mostly affects children. I mean, it can affect adults, but I mean, we've gained some immunity. One thing you should also note is that this polio, for out of 100 people that it affects, about 90 of them go unnoticed. They are asymptomatic, no signs and symptoms. You understand? Yes. So back to his question, how can we cure polio? Polio is not curable, but it is preventable. Yes. So far, what has proven to be very effective is vaccination.
The vaccination, is it a one-time thing or is there an expiry date? Would you need to take it again?
For you to be able to actually gain immunity from polio, multiple doses of vaccines should be taken. In the calendar, you have vaccines given to children at birth. If any of you have witnessed childbirth, you realize that immediately after birth, they give them something. So they give them polio at birth. That's 0, polio 0. Polio 1 comes in at week 6. The next one at week 14, I think, or week 10, 14. And then you have that, they take 4 doses, and then you have those booster doses that come now when you do these polio campaigns, when they come now around doing those booster doses. Yeah.
That's so interesting, because like now you're talking about terminology that we heard with COVID when you're talking about boosters and things like that. And I thought I was meeting this for the first time because I guess back then I was focused on the t-shirts and not the real issue. But I'm just wondering, when we talk about like polio in terms of like a virus, what about the environment that people are in? Where does it come from? Does sanitation play a role?
It does a lot. So for polio to be transmitted, it is transmitted through the fecal-oral route. When they say fecal-oral, feces, oral, the mouth. So when you come in contact with the feces of someone contaminated with polio, and you have means that can be transmitted through water, through food, it gets into your system. So that is why in the fight against polio, we don't only talk about the prevention by vaccines, but also highlight a lot about environmental hygiene and sanitation, good hygienic practices, hand washing, good toilet practices, and all of that. They play a very big role.
So you think can adults still take the vaccination?
Yeah, because it is not. We wouldn't say we don't at this point, since it affects a lot of kids and not adults. Adults are not exempted. You understand? The target is kids, because we have little or no cases with adults, but the target is kids. The adults can still take the polio vaccine.
We should do a lot of more communication around adults, because it's very funny that when you leave your parents' house, you just go into the world and you forget about vaccination. When you're sick, you go to the doctor and say, I think I'm having a headache. But I think we should do a lot of more communication when it comes to vaccines that adults should not take for granted, and if there's a need for adults to still go back to the hospital and get extra vaccinations.
Yeah, there's something I would say. I mean, if you're pregnant or you go to the hospital, you're only caring about your child. You understand? And when you give birth, you want to follow the vaccine calendar to the end.
Yeah.
But most people do not really understand. You go, they give you the polio, they give you the DPT vaccines, the yellow fever vaccine, and all of that, but they don't understand what this is. If they had a better understanding of what this is, they'll explain to their children, and they themselves will gain knowledge and understand if this can affect my child, and I'm at risk as well, why don't I go in further? So when we're educating, like say, you educate adults and you educate kids as well, especially for the hygiene and sanitation part, but the adults should be able to know that it doesn't only imply to them giving vaccines, following up their kids for vaccination, but also they have a role to play in the sanitation and also on their own part, their health, getting their own vaccines.
And so I wonder, Leah, what your thoughts are, because I feel like you're a feisty, what do you call it? Active citizen, not activist, active citizen of this continent. When we talk about issues around hygiene and sanitation, I know I feel a type of way whenever we're told, like, you have to wash your hands, you have to do ABCD, when accessibility to that is not the case for everyone. Unfortunately, it's a privilege. Like, what are your thoughts around how we organize, even in terms of just like public health, plus also the situation in communities? Are we preparing well, or are we just living in some sort of bubble when it comes to African leadership around these issues?
Yeah, no, that's a really interesting question. I think one of the things that strikes me is this idea of hygiene. It has a colonial connotation, if you think about it. Hygiene is somehow, at least the way sometimes it's received by the normal public, because this is something the colonialists were supposed to be bringing to us, right? Like, we were supposed to be part of civilization is getting cleaning yourselves and everything like that. And it almost puts a lot of, I would say, responsibility on the citizen, when actually a lot of times, for you to achieve that, you need to be enabled by your government, right? You need, for instance, like hand washing. Unless there's clean water around and taps around, even when you're telling children, like, for them to be able to effect that, they need to have clean water in school or wherever they go to be able to do that. Otherwise, it can seem sometimes condemning or like belittling to tell people, you need to, it's your responsibility to be clean, to wash your hands, to do what, when sometimes, a lot of times, we don't have that clean water. Yeah. We don't even have those taps. We don't have running water. And so I think it can bring a bit of shame, to be honest, like making it very much just about the individual without considering the responsibility of the government or whoever is responsible for providing that facility for us to be able to do that in our homes. I think the other thing I would say is, in a lot of places also, hygiene, as she said, I think you said it's about feces and water mixing. Part of that is not, feces and, what the water we drink coming into contact, that's really not an individual thing. A lot of times it's just whether we have, to what extent are we enabled within our societies to make sure that, because a lot of places, if in our countries, we don't have really good, like in Kenya, like a lot of places, we don't have toilets. Like some people don't have access to good toilets. Yeah. So that means sometimes they defecate in the bush. Yeah. So I would say, like, streets, exactly. So I think there's a bit of sometimes feeling disempowered, like feeling like we're supposed to do this, but there's no way to be able to achieve it at a personal level, because the environment that we live in, that is not about us, has not been enabled.
I agree with you, considering the fact that we in Africa, a developing continent, developing countries. But one thing you should know is that for us to be able to get to this 99.9% of polio eradication, it's not only thanks to vaccination. There has also been the creation of other campaigns to improve environmental sanitation and hygiene, pipe-borne water. Yes, I understand. In my country as well, Cameroon, you find that not every area has pipe-borne water or has these facilities. But alongside in fighting this, just like in fighting other diseases like cholera, the government makes it possible for some of these areas that are really at risk to have this facility. So it's not as if it's a challenge. That's why we're still here. And thank God, even though we live in these situations, we are still able to eradicate the polio in that area. But we cannot forget, it's not only about having this pipe-borne water. The basic, personal hygiene, you understand? If you miss it, you miss it. And if you come in contact with the virus.
So I found it very interesting when you mentioned colonization and hygiene in the same sentence. I don't think I've ever heard that. And so I'm thinking, if we go back there, weren't there things as Africans that we were doing that were healthy and that were good in the community, even when we think about like sanitation? we definitely had some processes that were effective, right? What do you think?
Yeah, I mean, I'm trying to think how we would know because we weren't there then. So I think I'll just draw on what I kind of heard, like asked from my grandmother and what I've read a bit of. Although, as we know, we don't usually have a very good record. But I think the first thing I think is that definitely, I think there was better separation between fecal matter and water, like water sources, like rivers and stuff like that than today. And I also think, and that made it a bit more safer to drink water from, from the river, for example. So this idea of tap water was probably not as pressing exactly. I think the other thing that has changed a lot, obviously, is this idea of urbanization and slums. That obviously we know that was unheard of during, before, I guess, colonial times and before this era. So, and I think part of the issue around sanitation is just also these slums, having too many, urban slums, places where many people are staying without the adequate design for sanitation and how to handle urine and feces.
So it's interesting, like when we talk about like urbanization, this is just so interesting to me because we talk about urbanization from a development perspective, but we don't know how it touches on health. So if you're creating a space where more people live, you then have to make it safe so that we don't have health crises like polio or cholera, etc. And what about the government's role? What do you think? Like, was the government's role in polio, and they were effective things they did? Because I mean, going back to your number, 99.9%. Yeah.
Without our governments, we wouldn't be here to talk about this 99.9%. So back in the 80s, the World Health Assembly passed a resolution to eradicate polio. Thereafter, there was the Global Polio Eradication Initiative that was led by the CDC, WHO, our governments, Vaccine Initiative, Bill and Melinda Gates, Gavi, and all of those other organizations. This is what helped to implement the polio eradication and campaign in our communities, in our countries. Because like I earlier said, the polio vaccine has been introduced into our vaccination calendars for kids. So if you go back to Kenya, if you go to Nigeria, if you look at the polio vaccine, the vaccination card for kids, children under 5, you're going to see that all of these vaccines have been introduced at 0, at 6, and all of that. So the government has actually played a very important role, and they continue to play these roles, especially now that we're talking about getting to the end of being eradicated. I don't remember if I already mentioned about the new polio virus variant circulating in Africa, where we have in Congo, in Cameroon, Nigeria, in Ghana, like that. Yes, so for us to be able to identify, it's not just about saying that, oh, polio was eradicated and then we fold our arms and say, no, there's a lot of surveillance going on in the background. Yes. So this
point where we would have a total complete eradication, 100%.
100%, 110%. Definitely, yes, because if we could come from the 80s, cases where you had 350,000 people in over 125 countries, and as of now, 2021, 2023, we're talking about 6 cases of polio in Pakistan and Afghanistan. Then you see how that has come over a period of about 30, 35 years. You understand? And if we continue with this fight, you're going to see that in no time, we'll probably eradicate polio. And just to let you know again that back in 2014, the Director General of WHO did put polio on the list for public health emergency of international concern, which means that all eyes, the international community, has to look back at polio. Polio is not eradicated, so they brought back that to the table. Yeah. Things like COVID, Mpox were on had that same status, but they're out of it. But polio remains, which means that, they're still focused on it, and there's work going on by these governments and organizations.
If we go to education and how we even teach children about, like, washing hands is something that you'll hear in classes, but it ends with a song. You're never linked. It never tells you what else could happen or whatever. So even when
usually about passing the exam.
yeah, exactly. Or the song. There's like a song, da, 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 and then it's over.
Find it a
So
little bit hard
you have to break it.
to relate, because I've actually seen and I've been involved. It's true that I may not have been able to evaluate the impact of the outcome, but I have seen situations a couple of times where there is this advocacy for personal and environmental hygiene. You understand? Where like the community begins. Where's the first community? The family. So by the time the teacher is telling a student, what do you do to maintain your personal hygiene? And if that child already has information from the home, you do this, you do this, you do this, and they'll be like, okay, this child knows. There's really, I mean, the government, we are the government, they do as much as they can do. But again, there is this call, we as citizens. As citizens, we have to understand, for example, what polio is, create this awareness. We will not wait. Take, for example, I'll take you back a little bit to COVID. You mentioned COVID and said, I agree, we're overwhelmed and we saw it happening in other places and we're praying that it shouldn't come. And when it finally came, we're watching it. Everybody was overwhelmed. What I would like to say is that our governments were not dumb. You understand? They tried to weigh the risk and the benefits.
We all want an end goal of people having access to knowledge that allows them to make the right decisions, and that we want people to be able to live in very sanitized conditions. Are we together? Great. I hope you enjoyed this episode of Back to Doc. I sure did, and I hope you have gained information and insights to help you make better decisions when it comes to your health.
I want to say a big thank you to our guests today, Nora and Leah. Are there any signing out words you would like to drop?
From my end, yes, polio is still there. It's still in our communities, and there is work to be done. We here, beginning from our families, we have to go out and let people understand what polio is all about, how it manifests, what are the impacts on the everyday citizen, on the community at large. What can be done? There are vaccines. How safe are these vaccines? Let them know. Give them that knowledge. Tell them the importance of these vaccines, and come back again to the basic fact of environmental hygiene, personal and environmental hygiene and sanitation. We wouldn't want to wait for a very big outbreak of polio, and then we start rushing for vaccines or start washing our hands, and no, we already know what we have to do. So let's see how back in our communities, and we encourage the others around us going for vaccinations to take care of themselves. Personal hygiene, environmental hygiene, and I bet you in the next 10 years, we'll be polio free. The 0.1 becomes another episode about
And Leah, what about you?
No, I agree with that, but I also want to emphasize the fact that we need to really think about the people that we're trying to support, the communities that we work with, and to remember to always center it around them. And to always remember that whatever we are doing, it's not the government doing at them or healthcare workers doing at them. They also have their own agency, and actually they want to be well. Nobody wants to have polio or have the side effects you talked about. Sometimes the issues we're having is just around how we communicate, how we engage. And I think we should see them as collaborators and people who can bring something to the table in how we are dealing with things, and to think about how we formulate how the actions we want to take in consideration of how they live their lives and some of the hustles and bustles they do. And I think we're going to go further if we do that.
Who's on them, but we work together.
Partners.
Well, it's been an exciting episode of Back to Doc, and you have been of immense help and contribution to this topic. It's really fun having you guys in the studio with us today. Adelle,
Yes.
it was nice working with you again.
I know. Although we're on different governments. On this side, yeah, that side, all right.
But I'm
This
sure you
side.
guys our government is winning. Cast your votes right. And I'm sure a lot of you out there have questions to ask. And feel free to always, one way or the other, reach out to us, Niyel Campaigns on Instagram, on Twitter. The handle should be somewhere around there on the screen. You'd find it there. Reach out and ask your questions. There will be someone that would respond to you. It's Back to Doc. I'm Ik Ogbonna, and it's good night.